Hello, my name's Lori Jarrett, and I'm a physical therapist at KSB Hospital. I'm one of our physical therapists that work with women's health. And today we're going to share with you some information on exercising during and after pregnancy. I wanted to start out by sharing with you some of the benefits of exercising during your pregnancy. One thing it can do is to help with appropriate weight gain. On average, it's been found that women who exercise throughout their pregnancy gain 8 pounds less than sedentary pregnant women. In addition, there's a decreased risk of C-section delivery in exercising moms. Evidence is also showing that there are benefits to the baby from the intermittent exposure to the moderate stress of physical exercise. Exercise also provides benefits for stress reduction and emotional well-being for mom. It's always important that you speak with your provider before starting any exercise program. I have listed here for you some absolute contraindications to exercise. These are ACOG's contraindications. ACOG is the American College of Obstetricians and Gynecologists. These contraindications are hemodynamically significant heart disease, restrictive lung disease, incompetent cervix or cerclage, multiple gestation at risk for premature labor, persistent bleeding in the second or third trimester, placenta previa after 26 weeks of gestation, preterm labor during current pregnancy, ruptured membranes, preeclampsia or pregnancy-induced hypertension, and severe anemia. There are also some relative contraindications to exercise, which means you would need to speak with your provider about the appropriateness to exercise. Those are anemia, unevaluated maternal cardiac arrhythmias, chronic bronchitis, extreme morbid obesity, extreme underweight, which is a BMI of less than 12, a history of a sedentary lifestyle, orthopedic or muscle and joint limitations, poorly controlled type 2 diabetes, hypertension, seizure disorder, or hyperthyroidism, and if you are a heavy smoker. When you are exercising during that prenatal time, there are definitely some signs of when you should stop if they occur. Those are vaginal bleeding, regular painful contractions, leakage of amniotic fluid, shortness of breath prior to exertion, dizziness, headaches, chest pain, muscle weakness causing a balance disturbance, and calf pain or swelling. Now that we've talked about all of the precautions and contraindications to exercise, we're going to talk about some guidelines for doing aerobic type exercise during your pregnancy. It is recommended that pregnant moms partake in 20 to 45 minutes of moderate exercise. Now that may need to decrease as the pregnancy progresses. And if you haven't been exercising prior to pregnancy, you may have to start a little lower than that, but you could do 10 minutes twice a day. When you exercise, how do you know how hard you should exercise? One way is to use the rate of perceived exertion scale. And I'm going to show that to you on the next slide. When you use that scale, you will want your exercise level to be between a 3 and a 4. Another great way to determine how hard you should exercise during pregnancy is to do the talk test, so that basically you should be able to carry on a conversation while you're exercising. If you are too out of breath to talk, then your intensity is too high. We also recommend that you exercise 3 to 6 days a week. So that 20 minutes and 3 days per week are kind of that bare minimum to show some of the benefits to the exercising mom during pregnancy. In addition, you want to make sure that you do a warm-up, and at the end of the exercise, do a cool down. This is the scale of the rating of perceived exertion. So you can see it starts at 1 and goes to 10, and we want the mom to be exercising on a level of 3 to 4, that moderate exertion. It is not accurate during pregnancy to use heart rate to help you determine your exercise level because your heart rate is going to increase during pregnancy overall. Some exercises and activities to be avoided. So some absolute contraindications. So scuba diving, water skiing, saunas, and hot tubs. The next list of activities that you need to check with your provider on are downhill skiing, cross-country skiing, ice skating, gymnastics, and horseback riding. The reason most of these are contraindicated or require you to speak with your provider is that they put you at some risk of injury. And so we don't want to have any injuries or trauma during the pregnancy. What types of exercises should you do from an aerobic exercise standpoint? Well, pick out some exercises that you enjoy and ones that cause you the least amount of risk. Some great examples are walking, jogging or running if you did this prior to your pregnancy, as during pregnancy would not be the time to start that. Using exercise machines like stationary bikes, rowers, ellipticals, and swimming. We often get questions about abdominal exercises while you are pregnant. There are a few things to remember with abdominal exercises. One thing is we want to have you avoid lying on your back during the first trimester because that can cause additional pressure on a blood vessel that provides blood to baby and to mom. To avoid this supine position and do some of the exercises, you can use a wedge or a pillow under your back to help you be at a 45-degree angle. We also want you to avoid typical sit-up-like exercises. Instead, we want to focus on a muscle called your transverse abdominis muscle, which is located just inside the pelvic bones, and it really helps to support the abdomen and the spine. When you are doing abdominal work, and really almost any exercise, you want to remember to exhale on the exertion portion of that exercise. Here's a picture of kind of that baseline and core abdominal contraction that we need everyone to do when they're doing abdominal exercises. So to do this, you would lie on a wedge or on several pillows so that you are angled up at about 45 degrees. Take a nice breath in, and as you breathe in, just let your abdomen expand upward. Then, as you breathe out, tighten your lower abdominal muscles, pulling your belly button towards the backbone and tightening your stomach down. Hold that contraction and then keep breathing normally. Once you can maintain that lower abdominal contraction while you breathe normally, you're ready to progress to additional exercises. Doing just that contraction is difficult, so you'll want to practice that first before these next two exercises. After you are able to maintain that contraction, you can progress the exercise to this leg straightening exercise. Again, you're going to lie on that 45-degree angle wedge, do your basic contraction, maintain that contraction, and over 3 seconds, straighten one leg along the floor, and then over those 3 seconds, return it to the starting position. You may only start with 5 of these on each leg, or maybe less. Work up to doing 20 on each leg before progressing to the next exercise. This next exercise uses the basic abdominal breath and contraction with a knee lift. So you're going to do the same thing, lying on the wedge, perform your abdominal contraction, and then lift one knee up to 90 degrees, lower it down, and then lift the other one. Again, you want to maintain that contraction throughout the exercise. Another set of muscles that are super important to work with during and after pregnancy are your pelvic floor muscles. Below, I have pictures of our pelvic floor muscles. The picture on the left is looking at the pelvic floor from above, and the one on the right is looking at the pelvic floor from below. These muscles help us to prevent leakage of stool and urine. They help to support our internal organs, and they have a role in sexual function. It is important that we be able to contract and fully relax the pelvic floor muscles. If you are able to contract those muscles, then you know when the muscles are relaxed, and you will be able to use that during the birthing process to help your muscles relax when you have the baby. It's a good idea to pick a specific time or activity you're doing each day for you to do your pelvic floor contractions. The hardest part truly is just remembering to do them. So maybe pick out that you're going to do these exercises at night during commercial breaks on TV, or maybe while you're standing, brushing your teeth, or riding in the car on your way to work. Start with quick contractions where you contract the pelvic floor muscles quickly and then relax. Sometimes it's hard to know if you're doing these in the right manner. Think about tightening the muscles as if you're trying to stop yourself from passing gas, or tightening the muscles as if you were going to stop the flow of urine when you're sitting on the toilet. Start with doing 10 quick contractions and work up to doing 50. You can do 2 to 3 sets of these exercises. Once you've mastered the quick contractions, move on to endurance contractions where you hold that contraction for 5 to 10 seconds. Now, I'm going to introduce you to Kristin Powell, who is a physical therapist assistant with KSB, and she's also a certified fitness instructor. Kristin?
It is important to incorporate functional movements during pregnancy for carryover after baby is born. These movements are movements you're going to be doing every day while caring for baby, and these correct movements ensure your safety while you're getting up and down from the ground and carrying baby around your house. The crib reach is an exercise where you're going to transfer baby to and from crib. Optimal crib height is going to be between the bra line and your belly button. You're going to start with a weight or baby at chest height. You're going to inhale and hold. Exhale, hinge, and you're going to place baby into crib and return to upright position as you continue to exhale. You're going to ensure that baby is where your weight is at the side of the crib. You're going to inhale, hold, exhale, hinge forward, grab baby or weight, and return the weight or baby to chest height. The second exercise is the ground get up. The purpose of this exercise is to lift baby and yourself to and from the floor. You can do this exercise starting from the floor or from half kneeling, and you're going to ensure that you're exhaling during the exertion part of this exercise. You're going to start with your legs extended, hands in front of you. You're going to inhale. As you exhale, you're going to bring yourself to tall kneeling and to half kneeling and fully standing. You're going to inhale, hold, and then you're going to return back to that half kneeling position and then to your sitting position. If this exercise is a little difficult, you can modify it by starting at that half kneeling position. You're going to inhale, hold, exhale as you stand, inhale, hold, and then exhale, returning to that half kneeling position. The last exercise is a baby lift. And this exercise, the purpose of is to work on reaching and lifting baby up. So you're going to hold a 5 to 10 pound weight or baby at chest height. You're going to inhale. As you exhale, you're going to lift the weight or baby up to a 45-degree angle and then return to your chest. Again, you're going to be exhaling the entire time you lift the weight up and then return it back to your chest. I'm going to return you back to Lori, who is going to speak to you about exercise postpartum.
Thank you, Kristin. Now, I'm going to share some information with you about some exercise activities you can do after you've had the baby. So what about those first 4 weeks? Pelvic floor exercises can usually start within just a few days after delivery, as long as you are feeling okay and as long as your doctor does not tell you otherwise. If you have had an episiotomy or a pelvic floor tear, please ask your doctor when it's okay for you to start those exercises. When your provider approves, you may also begin low-level activity such as walking within those first 4 weeks. Something that's important for you to remember, especially during those first 4 weeks, that just as important as the exercise is getting the proper rest and proper nutrition that you need for your body to heal. So make sure you pay special attention to that also. Between 4 and 8 weeks postpartum, you can continue to progress and increase your daily pelvic floor contractions. When I told you that you could restart those pelvic floor contractions, you may not have been able to restart them at that same frequency you were doing prior to having birth. So now during this 4 to 8 week period, you can start to build up that number again. With approval from your provider, you can consider starting a low load strengthening program. You can start with the back end with your basic breath and the abdominal strengthening that you did while you were pregnant. Except now that you've had the baby, you actually will not need to be on that 45-degree incline. You can lay flat on your back again. You can also add more challenging cardio exercises, such as stationary equipment and biking if you're comfortable with that, and if you are not having bleeding or incontinence with those activities. Still, during this 4 to 8 week postpartum period, you should avoid running and high impact activities until the pelvic floor and the abdomen have had additional time to recover and to heal. Make sure that throughout this time period, you are letting your provider know the activities you are doing. And if you have any pain or questions, to talk with them about this and the exercise. I've listed below some of our references, but I also just wanted to share that if you're having ongoing incontinence or ongoing weakness in your abdominals and pelvic floor muscles, that is a good reason to ask your doctor about a referral to physical therapy. We can help you to return those muscles to their previous function. Now I'm going to turn the speaker over to Gwen Strum, who's the director of our OB clinic, and she's going to share information on the 4th trimester.
Thank you, Lori and Kristin, for that wonderful information. My name is Gwen Strum. I'm the director of OB services here at KSB Hospital, and I really am excited to talk to you about what we have named our 4th trimester support group. So this is an opportunity for mamas in our community to come together and meet new moms, talk about maybe some things that they're struggling with, whether it's getting back into the swing of that exercise routine postpartum, like Lori and Kristin talked about, or pelvic health. There is going to be some discussion about our brain health as well. That is something that a lot of people don't talk about, but we should. It's really important, and having a community of mamas that are in a similar season as you to just kind of talk about your highs and your lows with really can help. And so I'm just really excited to share this information with our community. I hope that you or someone that you may know, a friend, a family member, something, can participate in our group. I wanted to let you guys know it is for any mom who is in a season with littles. So we used to say that the 4th trimester support group was for a mom that just had a new baby through about 5 months of age. But I really don't want to limit that age number to anyone, because the little years are hard, and there is a lot of need for moms in our community that have kiddos in those little years. And I really have this desire that moms in our communities can come to this group and be given the opportunity to see the beauty that can be found in the little years amidst the struggles. And so a couple of things that we will talk about in the fourth trimester support group are, like we had previously mentioned, pelvic health. Getting back into that exercise routine. We are going to have kind of a speaker every month that highlights an education topic, but that doesn't mean that's all we're going to talk about. It doesn't mean that if that isn't a topic that seems like it would pertain to you, that you shouldn't come. Each time, we'll have that little education topic. Might be on car seat safety. It might be on postpartum brain health. We're going to do a Mother's Day celebration in May. We're going to talk about summer water safety and sun safety for when you have your babies out in the sun. Just different topics. They're all listed on the handout, the flyer that says when the fourth trimester support group is. It is typically the first Friday of every month, unless there's a holiday in there. And it's at 9:30 at the Dixon Public Library. You do not have to be a KSB patient to have to attend this group. It doesn't matter if you delivered here or not. It doesn't matter, like I said, how old your baby is. If your baby is just in those little years, if you're looking for some education, for some support, for maybe a new friend, I would love to encourage you to come and join this group. I don't think that you will regret it. Thank you so much for your time. I really appreciate it. And I hope to see you all soon.